Well, ministers at the UN climate conference in Baku, Azerbaijan, have been told to cut the theatrics and to get down to business as frustration grows about the slow progress being made. Negotiators at COP29 are struggling to come to an agreement over how much financing industrialized nations should provide to developing countries to help them cope with the impact of global warming. Climate change is not just affecting environments around the world, it can also be a global health issue as well. Climbing temperatures and increasing rainfall promote the spread of dangerous diseases. We have this report now from Bangladesh on how dengue fever is becoming more common due to climate change.
Doctors were expecting patients, but this year's dengue outbreak in Dhaka, Bangladesh, has overwhelmed the ward. In the past, cases of dengue only rose during this season, but now there are dengue patients all year round. However, this season is more intense. We're under a lot of pressure here. Dengue is a virus that spreads from mosquitoes to people. Symptoms are usually mild, but in severe cases it can be fatal. Where mosquito numbers once dwindled in cooler months, heavier rain and warmer temperatures, due in part to global warming caused by burning fossil fuels, are providing the conditions for them to survive. And it's not just in Asia. Spraying insecticides in Europe to kill off the invasive Asian tiger mosquito, which transmits dengue and other viruses like chikungunya and Zika, has become more necessary as they move north. Found in 8 European Union countries in 2013, just over a decade later, the species is fully established in 13, including France, Germany, Austria and Hungary, and has been introduced in a further 6. In 2023, there were dengue outbreaks in Spain, France and Italy. Changing rain patterns and warmer conditions in the United States are also leading to further spread of disease from some species of ticks and mosquitoes.
People will be more exposed, health systems will have to cope with an increased burden of disease associated with these pathogens spreading. And in particular, we're going to see new locations starting to suffer from the impacts of infectious disease transmission in locations that were previously considered relatively safe.
Extreme weather events worsened by rising temperatures are also taking a toll on human health. Severe drought in some regions has decimated crop harvests, leading to undernutrition. Flooding can lead to contamination of water sources, causing outbreaks of illnesses like diarrhea. The World Health Organization estimates there will be another 250,000 deaths per year between 2030 and 2050 from health conditions linked to climate change.
So what we need to do is quickly adapt to the high temperatures that we're already seeing, and we know that now will continue to rise inevitably, but also to reduce our greenhouse gas emissions.
Without action, say experts, scenes like this in Dhaka are likely to become more common across the globe.
Well, I'm joined now by Rob Butler. He's Director for Environment and Health at the WHO. He joins us from Baku in Azerbaijan. It's good to have you with us. You know, the health impacts of climate change are clear. How is that reflected in the negotiations at COP29 where you are?
Well, thanks for inviting me. Indeed, it's very promising, actually, that the Azeri government have placed health at the centre of the discussions. Indeed, today is the health day at COP. In Dubai, at the previous COP, we also had a dedicated day to health because all aspects of health are impacted by climate change, not just those that you saw in the report that was just broadcast. Respiratory, cardiovascular diseases, mosquito-borne diseases, as you saw in the video. Also, cancers linked with air pollution, malnutrition from disrupted food systems, and a huge looming mental health crisis. I think in the European region where we're seeing this most acutely, and that's the region in which I serve, the WHO regional office based in Copenhagen, where we see this most acutely is on heat health. Just in the last year, we've seen 175,000 deaths from heat in Europe. The crisis in Europe, temperatures are rising at double the global pace. So this is very alarming and something that countries have to prepare for, of course.
Yeah, we hear those reports all the time, how Europe is heating up faster than the rest of the planet. How can countries in vulnerable regions, how can they adapt to climate-driven health threats and health challenges?
Well, let's take heat as an example. Heat health adaptation plans. Many countries don't have these plans in place. Those countries that have heat health action plans in place, they're underfinanced. Many of those countries have not tested those heat health action plans because, of course, when you have a heat wave, when you have an extreme weather event, flooding included, it puts an incredible burden on your health system. And it requires such resilience, not only in the health system, but the community. Though we test other plans, emergency plans, pandemic plans, and so forth, but we seem to be a little behind the times on how we test our heat health action plans and our preparedness for climate-induced and extreme weather events.
And one answer could be more air conditioning here in Europe. But you know as well as I do that a lot of people think that that in itself would present a health risk. So it's almost like the solution could just compound the problem.
Absolutely. Look, we've got to cut carbon emissions. It's that simple. It's great for planetary health and it's great for every living being on the planet. So planetary health, in the sense that, of course, if we cut greenhouse gases, we're going to see a reduction in climate change and a slowing down of climate change. But if we can get clean air, particularly to people in vulnerable situations, the most marginalized, we have 569,000 premature deaths in Europe from breathing poor quality air every year. That is remarkable. And that is something we can change if we choose to mitigate and do something about climate change and cut those emissions, which is why ultimately we're here in Baku.
Before we run out of time, I want to ask you about the money. Is global climate finance, is it meeting the scale of health risks that are posed by climate change?
It's a great question. Look, I was in COP last year in Dubai and they were talking about billions needed in terms of investment. Now they're talking trillions. It's interesting the G20 are meeting today. Those 20 countries contribute to 80% of global emissions. So it is a political choice. They can make the choice. They can invest. They have the money. But clearly we're not seeing the investment we need. And that will be an exponential increase over the years if we continue on this course.
Rob Butler, Director of Health at the WHO, joining us tonight from Baku in Azerbaijan. Rob, we appreciate your time tonight. Thank you.
Thank you.